I'm Edward Warfield. I'm the publisher of City Biz, and I'm honored today to interview Diane Bell-McKoy, who's the CEO of Associated Black Charities. Welcome, Diane.
Thank you for having me here. And when I have to make one correction, I consider myself the team leader of Associated Black Charities versus the traditional title of CEO.
Okay, correction stood. Okay. Associated Black Charities was founded in 1985 with a $100,000 planning grant from the United Way. Can you provide an introduction to Associated Black Charities and a brief history?
Certainly. Associated Black Charities, as you've already identified, was founded as a grant from the United Way. It was a community-wide effort, somewhat inside of the United Way at the time, with a number of people, African Americans, in the larger community in Baltimore of African Americans ministers and others who felt like the needs of the Black community were not being served by United Way at that time. And they also thought that they could involve more of the African American community contributing directly if they had their own organization. And so thus, that's how they went to the United Way. There was an internal committee that did some work and studied it, as well as the work of external ministers, leaders, and there were Black and white leaders who pushed for a organization called Associated Black Charities. They looked at other organizations in other parts of the country, and that's how they came to the conclusion of forming ABC, Associated Black Charities. The key that the audience needs to know, the founders used, like the term of Associated Black Charities, but more than anything, thinking that they would be an association of charities, they wanted to have the alphabet of ABC because that would place them at the top of the list for United Way giving.
So can you share with us, you've got some upcoming an event series called Equity First and its upcoming finale event on Giving Tuesday. That sounds pretty exciting. You've got a interesting lady you're going to be interviewing. Can you tell us about some upcoming events?
I absolutely can. I'll tell you about the last speaker of the year, and I'll go back, but the last speaker of the year I will share with the audience is absolutely positively a blessing for ABC, and that it is Oprah Winfrey. She is our last speaker for the Equity First series, and we're very excited to have her as our guest speaker for that series for our last event. Equity First series was developed by our development department and a program staff, and wanted to have a mission-driven focus. In all of our fundraising, we want people to be clear about what our agenda is. And this was a way to be clear that our agenda is focused on racial equity, and that having speakers who could talk about their own lives and where they were in their own journey was an important part of the agenda. And so Equity First as a speaker series was born, and it was also born out of the fact that our development director had a speaker series at her prior job, and it was successful. So that's a combination of mission coming together with someone else's history to say that we could prove and do this as a successful tool for getting out information and having speakers from across the country. One of the positives, very few positives, but positives about COVID in this environment is the virtual conversations that can happen with people all across the globe. And so with that, we had a huge blessing to have Ms. Winfrey donate her time of allowing me to do an interview with her as our fourth and final speaker.
That's very exciting news.
And so that is our Equity First series.
So how are Associated Black Charities leading the charge to close the wealth gap that put African-American families at a disadvantage? And how are you trying to create sustainable outcomes?
So this Associated Black Charities agenda is often a tough agenda to explain to people because we're not doing traditional things that organizations do as we focus on changing outcomes for citizens, whatever the race, whatever the issue. But we got very clear, and the we is the board of directors at the time, about 4 years ago, very clear along with the senior staff, as we looked at data, as we look at where we come from, and you looked at where we were in Baltimore in terms of people, African Americans, where they were on the lines of economic mobility, in terms of employees and where they were employed, Black workers were employed, and what was happening in that space. it was clear that Black workers were very far behind white workers in terms of their economic mobility, their wages, and opportunity. And so at that time, you recall, there was a number of things going on in the country, including after Freddie Gray, just before that we were clear one of the core root causes for the racial wealth gap in this country, not just Baltimore, is structural racism. That's a very tough thing to tackle, but we were clear that we also had to lay that out front and center. If we were going to achieve some sustainable, transformative changes, we would have to tackle this issue called structural racism. And we'd have to tackle it in the entire ecosystem that makes up helping people move to work. And that's all those systems engaged in helping Black and brown people move to work. That's funders. That is, in fact, policymakers. That's, in fact, training providers themselves. That's employers. And how do we make sure the Black worker is situated front and center and has the tools? Because I often share with the public, and that many, many people know this to be true, Black people are not broken. Systems are broken. So what we're seeking to do is change those broken systems. And that takes one step at a time. It takes talking to leadership, helping them change how their organization operate in terms of policies, their practices. It takes lots of conversations. It takes coalitions. There are other tools that we use that I would consider we talk about as our transactional tools. So we know that workers, Black workers, often don't have access to relationships. They may receive excellent training and be a great employee going into pharmacy tech, going into biotech, but they may not know some of the ins and outs of thinking about advancing their career, thinking about challenges that may come up against. And so our volunteer career mentors are volunteers that are trained based upon a curriculum that we had designed actually twice, has been modified to help those volunteers who become mentors to work with those workers now going to work. Help them think about career, help them think about moving the ladder, help them think about finances, help them think about just managing all the things that many of us take for granted in terms of moving forward in our lives. Because again, Black people are not broken. They may not have access to information. But that's a transactional to help them move and make sure they stay attached to work. The data told us that without those opportunities, without those kind of tools, that Black workers may not stay attached to work. And we know that's a critical part of getting the opportunity of upward mobility is staying attached, while we also deal with the environment inside of a particular place of employment that may be limiting to people of color. We have something called the board pipeline. We looked at data. Again, we used data. We looked at the data. It was a regional effort to look at data of the nonprofit boards in the region and who were leading those organizations and who were they serving. Well, it wouldn't surprise most of the audience to know that the organizations were led by white persons, often white women, and the boards were largely white male and white females. And they were serving largely people of color, Black persons, brown persons, but they weren't on those boards. And we all know now, we know what difference it makes if you've got a set of lens that look like the people you're serving. They bring information, they bring the culture, they bring knowledge that may not be available to others. They bring their lived experience. And they bring, if they have gone through the board pipeline, they bring a set of knowledge that we provided them, trained them on how to be a successful board member and how to recognize isms when they come up. Sexism, racism, classism. Those isms are out there and they can be disconnecting for boards who really want to do great work but don't recognize what they don't know already. That's very transactional, but it's a transaction that's to lead to transformation. Transformational work for us includes working with nonprofits who are workforce trainers, who themselves recognize that their organization may not have been developed. Their policies may not have focused on Black persons in terms of a positive way. They may have viewed them by the language they use as something negative. Oh, well, they really can't make it, or they're really challenged because of this or that. And that's not true. And so helping them shift, helping them really begin to be different in how they interact. So they then are not only producing powerful persons prepared for work, they're producing also moving and talking to employers to help them understand what a jewel this person is and how to help that organization, employer, begin to shift. We do training for employers. We do that as a fee for service, but we also do that in terms of helping employers begin to go deeper on where they're challenged, where, again, implicit bias and just issues around their policies, their practices. You cannot change anything impacting around race and inequity unless you're looking at data. And so an employer, you need to look at your data. What does it say about people of color, Black persons? What does it say about their upward mobility? What does it say about who's fired when? What does it say about your managers? What does it say about your boardroom, who's on your board? Data is a critical tool of moving from inequity to equity, but you've got to be willing to open yourself up. And more than anything else, the leadership has to be willing to say this matters and this is something we're going to tackle and we're going to move forward, because not only does it make a difference, it's not about a moral decision, and I really want to make that clear. That's important. It's about an economic decision. When we're able to change these outcomes for Black workers, it's amazing that we actually change the dollar impact for the city in terms of workers making more money, being able to buy a house, more taxes. It's amazing economically what that does for all of us and what it does to the business. If I'm not dealing with turnover, if I'm actually using somebody in my organization, I can move up and they know my culture and they're a part of it. What does that do economically for the bottom line for business? So this is not a woe is me conversation. This is not a social conversation. This is an economic conversation. Changing and focusing on a racial equity agenda for this city and for this country is an economic agenda. And hopefully we will all begin to move in that direction, recognizing how it will benefit Black America. It will benefit all of America.
Your career included a stint in Baltimore City government under Kurt Schmoke, and that in 1994, you led the country's most successful empowerment zone. Can you walk us through those career inflection points and your decision to join Associated Black Charities?
I will say my decision and my time with Kurt Schmoke, and Kurt hates for me to share this because I say this, it was like Camelot. I only say that because all of us involved in Kurt's administration, the cabinet, we were very committed. It's not to say that any other administration isn't, but I think we felt under his leadership a real sense of commitment. This was a Baltimore-born person who became the mayor, who was very different than traditional politicians. And not that others weren't great, but this was a politician who came from Baltimore, who wanted to make a difference for Baltimore and thought outside the box. And we all remember now his statement about the need for legalization of marijuana, the legalization in terms of treating drugs as a public health. Isn't that amazing? That's now common accepted knowledge. We should be doing that. It wasn't true when he announced it. He got a lot of pushback. And so I had the opportunity even then in Kurt's administration to look at systems, to begin to think about changing communities by looking at the systems, by making sure the community had a voice at the table. Kurt always stood for that. The community had to have a voice at the table. It couldn't just be the businesses, or as a community called them, the suits. It had to include all of them. We knew that, he understood that vision. Unfortunately, couldn't move to the next level in terms of he was no longer in office, and then things changed about what the values were for communities after he left. But it was administration committed to change, committed to making a difference for all of Baltimore, but understood the importance that the community had to have a seat at the table. For me, because that resonated so much with me, having come from Marion Barry's administration in Washington, D.C. to Kurt's, then the empowerment zone became a natural. And as I say that, I have to pull back slightly as I say a natural. Because if I'm honest, I will share with you that Kurt, Lynette, and others, head of the Goldsecker Foundation, others were asking me to go after the position. I went there on an interim basis to help. And I was leaving there to go to the Casey Foundation. I wasn't going to do the empowerment zone. They said, no, we need you to do this in the interim. The leadership that was there didn't quite work out. Great leader, but all the community, all the different stakeholders that came together, they needed a different kind of person. So I did it for a very brief period of time. And I was clear I was leaving. And nope, I'm not applying for this job. And I tell people this story that I learned then more than anything else, that my arms are too short to box with God. Because the next thing I knew, I interviewed for the job and I got it. But it was during that time that I really got clear about the power and the voice of community, and the fact that this community in Baltimore could sit at the table with the suits, with businesses. This community in Baltimore had a vision for itself to make a difference in terms of its community, its children, its future. What I will tell you now, and I will continue to tell people this, we were successful in many ways in terms of moving people to higher level jobs. And we actually were able to measure wage record data with the University of Baltimore. Even to this day, I can go back and have University of Baltimore look at those wages by Social Security number with no names and tell you what they're making now. And in fact, they're making a great deal more, depending upon the category you came in for job training. Customized training was the highest return on investment. I can tell you the difference that the amount of dollars invested in parts of the empowerment zone made a difference, including Inner Harbor East, which most people don't recall. It's the empowerment zone. I can tell you about lots of challenges, but I can also tell you that it wasn't enough. I don't know that we have learned yet the importance of deep and long commitment and investing in both physical and human capital change. That both take time and they both require different kind of capital. But we tracked our data. We used outside groups to track our data. The community was a part of decision making for how we invested the money. And we continue to be very focused on the original plan. Any changes to the plan went to the community for their input, and we stayed on point. And that which made us different than many other cities that had an empowerment zone. And we actually stayed around for a number of years and continued to invest, including loan funds that had a return on investment. The interesting thing about this, I must share, is that loan fund in the original application was only to be $1 million. The community advisory group, 50 different people from the community and other sectors came together, created a committee to look at how can we do better and should we have more money in loan funds. Guess what? They said we should, and so we did. That's the difference for Baltimore in terms of the empowerment zone. So clearly I know and learned then even more of the power of Baltimore being able to come together to solve some of its problems.
And can you highlight some of your milestones since taking over Associated Black Charities? Just some of the key things that you look in the rearview mirror. This was an important point.
I would tell you that one of the important points from the beginning when I got there was just, first of all, making sure the board and others and external partners and stakeholders were able to keep ABC moving forward. It had some challenges. And so it was a kind of put your shoulder to the grindstone and we're going to make this work. And they did. Lots of funders in terms of Casey Foundation and others, lots of board members and leadership. My dear Dr. Walter Ampre, who was deceased, who was one part of that leadership. And so those are really great milestones about organization. Black organizations don't get the same level of funding for infrastructure, for development. That's a reality. That's fact. And so you have to keep pushing past that at times. But certainly we also, in the beginning, did a number of grants. We had the dollars to do grants in workforce. We did the same thing. We tracked the data. We knew the programs that were getting the dollars to, in terms of competitively applying, but it also was a set of lens seeing Black and brown people, Black people as positive and not broken in terms of moving that forward. But we also we were clear. The data said we ought to be looking at creating a greater middle class, a greater Black middle class in Baltimore. Unfortunately, that agenda was just too big for an organization without the necessary resources to make that happen. So we pulled back. And that's when we pulled back and said, no, we've got the data that says if people get the opportunity, they can grow in their wages and they can then grow in their wealth. They can buy a home. They can start a business. So let's focus there, but let's understand what the root cause that's preventing that from happening. And that was structural racism. So lots of those outcomes now, or some of them are small, tangible steps along the way, but some of them, in fact, the number of volunteers in terms of over, I guess it's now 8 years, over 500 in terms of that have been a part of 350, that have been a part of making a difference in the lives of Black workers and continue to move that agenda forward so those workers stay attached to work. And as I talk about that as one of the successes for us, I would also stop and say, we're always looking for volunteers. And so I'm going to make my pitch for anyone interested in becoming a volunteer career mentor, that we do the training and we don't ask you to do that. And that workers also continue to be attached to the workforce program for other supports. But it really is what we can all provide if we've been successful in our career, support for somebody else wanting that success. The other success, obviously, is the board pipeline in terms of clear numbers around over 10 years. We've done the board pipeline. It is amazing the number of Black professionals that have come through that door. When we began, were Black professionals that, in fact, had not sat on a board before. Now, I believe the numbers are about 50% have sat on a board before, 50% had not. We get an overwhelming number of nonprofits from the region who come to the reception, which happens about a month after the training ends. It's a 5-week training. Just in the evening, I believe it's like 2 hours. But after that, people come and they really walk in the room or walk in the Zoom room with their list of those persons they want to talk to, they want in their board. Talented. All these are professionals who want to make a difference, who want to give back, who want to be on a board because they know having their voice on a nonprofit board in Baltimore that serves largely Black people could make a difference for many Black citizens that are out there who want to do something different, but that organization may not quite understand who they are and all the needs that they have. And so those are clear, very tangible in terms of our 10 essential questions for racial equity. I have to tell you that the two persons that developed these for ABC, Adara Yara, who is no longer with us, but brilliant, absolutely brilliant in terms of working with the legislators, having designed our 10 essential questions for racial equity. It's available on our website to anybody to use. Again, it points to the need for data to ask yourself some key questions about a piece of legislation. We often believe that legislation is developed in this universal way that's going to benefit everyone. That's not true. And you have to look at the data. You have to ask yourself the questions. You have to look at the numbers and how is it rolling out? How has it rolled out and impacted negatively people of color? But in fact, then we have 10 essential questions for workforce providers. Claire, in terms of actually developed that tool in terms of another phenomenal, talented Black professional who has moved on in another state right now. And so we have I believe we now have 4 of those 10 essential questions and new talent that's come to the organization who are going to be moving that forward, working with workforce providers, with legislators, with employers to use those 10 essential questions. We've learned from foundations that they've actually used. Several of them have told us they've used our 10 essential questions for racial equity. I'm pleased to say that Weinberg, Rachel will share with people that she began the journey around racial equity based upon the conversation with ABC. We had a partnership with Aspen, Baltimore, with Laura Gamble's a part of that. These are the steps along the way that when PNC, I'm going to take credit, Laura Gamble is going to kill me, but I'm going to take credit along the way. PNC is now looking at this issue of racial equity across the country, not just Baltimore. PNC is one of those employers very quietly moving forward, analyzing, looking at their procurement, looking at their data. Laura Gamble is a local leader that got very clear about the importance of looking at this, what it meant for her bank, what it meant for her bank's success. And she was at the table with us as a part of Aspen, Baltimore, to begin to keep growing and moving in that direction. But those are incremental to get to the major outcome that will be there when PNC becomes a transformative organization, when Weinberg becomes transformative. They have an African-American trustee that Rachel would never thought they would have, an African-American Jewish trustee. In terms of they got clear the need to pay attention to these issues will make a difference for the communities they seek to serve. That's what our work is about. So it changes the economic outcome for Black persons in Baltimore.
And so how do you apply a racial equity lens to workforce practices? And so what initiatives is ABC implementing in that area?
So we have something called the Community of Practice. Our workforce strategists in terms of that, Tiffany Truss and Jonathan Law are the team that work with our Community of Practice. Community of Practice is what it says. It's workforce practitioners coming together. I believe they come together quarterly. Very clear agenda, learning agenda around structural racism, around how it plays out, what it is, first of all, how it plays out within systems, how it impacts Black workers, clearly plays out in terms of how do you help the workforce professionals participating. They've wanted to know, how do I begin to bring about change in my organization? So you're giving them training and you're providing them reading and learning to help them bring about that change after they understood what it is and continue to grow their knowledge of what it is. I'm still a student of this. I clearly not consider myself an expert, but the community of practice, like all of us, we should all be in a community of practice. But that's what the community of practice does with workforce providers, bringing them into that room and helping them change their understanding and actually then helping them go back and look at their policies. Go back and look at their practices. We had special funding from Casey Foundation, which has been a huge supporter, where their grantees that were workforce practitioners, we got a chance to go deeper. We got a chance to sit with them. They had a particular issue maybe with their leadership team, not understanding this, and they knew that was making a difference, how the leadership team supported the workers. And so we, in fact, had a trainer work with them, begin to shift their lens. One organization, I won't name, but one of the workforce organizations, I don't think this was just ABC's work, they actually changed a contract they had with state government and how state government referred to the workers. They serve a youth population, and many of those are Black. But that language that was used was a very negative language. When they understood that language makes a difference, how Black youth hear and see themselves and view themselves when you use negative language, they went, we can't do that anymore. That's a change. That then is a change how that person walks out that door. Not just that one thing, it's a collection of items that have to be changed. We're working with another group of workforce providers called the Practice Advisory in a partnership with the Mayor's Office of Employment Development. They got clear they want to have voice. They're practitioners that recognize they're the closest to hearing what people on the ground who are looking for jobs, who have gone to work, who need training, they know what they're saying about their lives. They know what's important. But those community practitioners haven't always had voice. They felt like they had to respond to whatever the funder said, whether it was city, foundations. And so we're working with them, helping them shift, find their voice so they can become the voice for Black workers in the seat they sit in. That's ongoing work now in partnership with another consultant that will take time. We'll be called back to some training for the board, for the Workforce Development Board for Baltimore City around helping all of the board come together and understanding what is racial equity, how does it play out, and most importantly, how they can use their influence, their power to make a difference for Black workers. We all have influence and power. If we're in this world and in a profession, and we've got influence and power that we can use to make a difference for Black workers. How do we help people learn how to do that? How do we help people learn how they're not doing that? So those are very tangible things that we're doing right now.
So what are the strategic growth plans for ABC? What's on the horizon?
I will claim this in terms of as Diane Bell-McKoy. First, I have to claim this has nothing to do with ABC. As I make this statement, I've got to claim it as my own statement, and that is, I believe in God. And so with that, I will tell you that with his listening, that one of the things that is clearly one of our strategies for the future is our strategic plan said that we also knew if we could find an employer that would clearly be an example of taking some issue that was racialized and actually agreeing to deal with that one issue or deal with multiple issues that were racialized. If we could change that, use one employer as an example to say this can be different for Black workers. And so we have applied to funding for National Foundation to get funding to work with 2 hospitals, if we get the funding, to look at those entry-level workers, first-line workers, in fact, where they could have the opportunity to move up. If we looked at some jobs that were available that required a college degree, but didn't need a college degree because of a licensing requirement. But that was something that was put in place historically. So we know factually the Biotech Institute is a perfect example of that. In Baltimore, training persons to become biotech technicians that was started under the Empowerment Zone. But we proved that you don't need a college degree for a job at the time. J.C. Wise, as the owner of a biotech business, says, I got to have college degree people. And it was up against the wall and he had to get it done. We said, why don't we use our money, Empowerment Zone money, and make a difference and translate that job into didactic training skills that you don't need a degree. Guess what? It worked. So on the horizon, we want to prove you can do that on a bigger scale, and you can do that in healthcare. And why healthcare? 58,000 Black workers in Baltimore in healthcare in those low-wage jobs. We want to prove, and that we believe hospital CEOs want to prove with us, that you don't have to stay there. You can go up in that system, and it can actually make a difference economically for that hospital and economically for that family. Most important, economically for the city of Baltimore. And so we're excited, looking forward to that opportunity. We're excited, looking forward to expanding our fee-for-service. Anybody out there interested in fee-for-service and working with us and helping you make the transition, helping you begin to move towards transformation. We're here to do that. We're excited to go deeper in the lane in terms of with legislators and other organizations and moving this forward. We know that Black workers, Black persons are not broken. Systems are broken, and we're going to be about collectively working with other partners to begin to change that and continue to making a difference in this city that will have impact throughout the region.
Well, my last question I usually ask, is there a question I should have asked that I haven't asked? But I'm going to reframe that a little bit. So what would Oprah have asked that I didn't ask?
Well, the difference would be, what question might I ask Oprah? Because remember, I'm doing the interviewing.
I don't know. I'm sorry. What if Oprah was interviewing you? What was the question that Oprah should have, Oprah would have asked that I didn't ask?
I think Oprah would ask, what are we doing to continue to make sure that people in this city know that they can make a difference, that people are clear about the difference they can make? And I would answer and say, we continue at every opportunity. I would share with Oprah. This is actually a title of a book of a friend of mine. There's actually 6 authors. The friend, her name is Dr. Tracy Durant. The book they just came out with, and I'm plugging it shamefully, is Humanity Over Comfort. And it would say, how do we continue to make sure we choose humanity over comfort? And I would say our very work, Oprah, it's about choosing humanity over comfort, because that's really what this is about for all of us.
It's obviously heartfelt and an important statement. So I've really enjoyed doing my homework and research and getting my arms around ABC. It's really an incredible organization, and they are very blessed to have a very dynamic leader in you. So thank you for your time, and best of luck interviewing Oprah.
Thank you very much. I'm sure I'll be a tad bit nervous, but thank you very much to all, to your audience and to your team. Thank you. From my team, my board, to you. Thank you.